everybody, my name is Dr. Jones, and this is my hospital. Here, I treat lots of patients and help them with their diseases or injuries. I'm waiting on our first patient. Let's see who it is. Doctor, I'm hurt. Where's the doctor, everybody? It looks like she's limping. She's waiting in the waiting room. Perfect. Hi, my name is Dr. Jones. Oh, it looks like you've hurt your leg and your arm. We'll get you right into the waiting area. But since you're already here, we can go into the room and get you all checked out. Here's a wheelchair so you don't have to walk. There we go. This way, she can easily go to the room. Sit down. There we go. Let's push her into her room. Time to get all checked up. Look, it's a beautiful hospital bed. Here, she can lay down and we can help her out. Now, let's have the doctor take a look. Okay, sit up. There we go. Now she's lying down and we can take a good look at what's really happening. It looks like she fell off of her scooter. Now, the doctor will check her heartbeat. Won't you, Dr. Jones? Yes! Okay, let's take a closer look and he's gonna check the heartbeat. Do you hear that, everyone? That's a heartbeat. He's using a stethoscope. Now we're going to use this to take a look at her ears. We need to check if they're clogged or anything. It's standard procedure. Okay, first we're going to check her right ear, then her left ear. Looks like everything's good. Now, time to use a thermometer to see if she has a cold, because we want to give her some medicine if she does have a cold. Doesn't look like it, no fever. We're going to take this weighing scale and put it right down below so we can take a look at her weight. She won't put too much pressure on her left ankle since that's where she got hurt. Okay, looks like everything's perfect. Now we can get to treating her. It looks like her knee is hurt, so we're going to give her a cast and we're also going to wrap her arm up. But we also will need to give an injection. I'm sorry. First, let's give her a little cooling pad because she has been sweating since she's been in the heat all day. So I'm going to fill this up with cold water. Brrr! Now, we're going to close it off and put it right on top of her head so she can cool off a bit since she was in the sun all day. There we go. She can rest for a while now. Time for the injection. It won't take too long. 3, 2, 1, and there we go. Let's put it in the plate so we can maintain hygiene. We are all done with that. Let's take a look at her x-rays that we made. This will show us if her knee or ankle is broken. It looks like her ankle isn't broken. The top of her leg is, and the knee is perfectly fine. She has hurt right there on the other side. So we're going to use this casting and put it on her feet so the bone doesn't move around. This way it will heal completely. Okay, hold tight. We're going to put the cast right on. But first, let's remove your shoes because we don't want the shoes getting in the way. There we go. Looks like her foot has been hurt right above her toes. Now we're going to open the cast up. It's fluffy on the inside. Oh, her little cooling pad fell off. We'll put it right back on and we're going to put the cast on nice and gently. Now close it up and that should heal in a few weeks. There we go, all closed up. Look, her toes are peeking out, but she doesn't have to wear shoes. Okay, you're all done with your leg. Now the doctor's gonna come in to do your arm casting because you did twist your wrist a bit when you fell. Yes, I did, and it hurt quite a bit, not as much as my foot. Sounds good. Since it just hurt a bit, we're going to use this cloth fabric and it's just going to wrap around her wrist and it'll help a bit. It's really flexible. It's like a little tensor bandage. So we're just going to wrap that around her wrist, and we're going to go in between her thumbs and her fingers. This just acts like a little flexible fracture bandage, because since she didn't have a fracture, it will help. Just a slight twist. And we need to make sure it's nice and tight. So let's do that again. Just tighten it up. There we go! Isn't she such a brave girl? Okay, now we're going to use the cooling pad just to cool her wrist off a bit for some relief of her pain. All done. Here we have some teal crutches. Aren't they so cute? This will help our doll stay off of her foot that's fractured to get it healed. So we're going to give these to her. Look at her using them. She does amazing. She is very brave. Okay, good job on your crutches. Here are some of your pills that you are going to need to take so you don't feel so much pain. This is a little pill box, and take one daily. This will help heal. And also, you can use the wheelchair anytime you want. Perfect, thank you so much, Doc. Of course, here's your wheelchair if you want to sit down if you don't want to stand all day long. Sounds good. Thank you so much for coming to this hospital, and thank you so much for treating me, Doc. Of course, any day. Thank you so much for watching, everybody. Subscribe and like this video, and stay tuned for more videos. Bye-bye!